Alright guys, we're going to go ahead and continue on with our toxicology PowerPoint. Did I get it pulled up? Okay. Alright, so we left off last week. We almost got through narcotics, but not quite. So we were talking about heroin and some of the other narcotics. Going backwards. Okay. That you might have heard people talk about before. So we talked about opium at the very beginning of this PowerPoint because it comes from the opium poppy. Heroin, codeine, morphine are all kind of in the same family of drugs. Methadone and oxycodone are all narcotics as well. So a lot of times when people have overdosed on narcotics, once again you'll see kind of the similar symptoms here. It tends to affect the respiratory and the digestive system first. With heroin and codeine and morphine specifically, it tends to be the most obvious when it comes to the digestive system because oftentimes people will have spasms in their stomach, which will cause vomiting. Oftentimes if someone is found overdosed, they either have already vomited or they will be vomiting whenever they come to again. There's also a lot of lack of circulation because it attacks the respiratory system, so seeing things like cold clammy skin, blue fingernails and blue lips, or just someone having difficulty breathing can oftentimes be a symptom of overdosing on narcotics. The oxycodone is technically prescribed by a doctor, but there's a lot of limitations and restrictions on this particular drug, so it's not often prescribed anymore because it is highly addictive. But people who get addicted to it, over time, due to pain reasons, or they don't follow their prescription directions and they take all of it at one go, whatever it might be, that can even lead into issues with nervous system stuff, causing them to have seizures. And all of these, if left untreated, so if someone overdoses and nobody finds them, oftentimes can lead to death as well. Okay, so keep in mind, with an overdose, it's not that they just pass out for a little while and then come back. Oftentimes they pass out to a point where they die. Okay, so keep that in mind as we're talking about overdoses as well. A lot of the Narcan that you might have heard about, in the news and just through general social media stuff. So oftentimes when people are overdosed on narcotics, they'll use the drug Narcan to revive someone who is overdosed on those particular drugs. With Narcan, it's usually injected, is the original form of Narcan. So it comes in something that looks kind of like an EpiPen would, and then it would be injected into usually the fatty tissue areas of the human body, so the hips, thighs, butt, stomach area. Recently they've come out with it's almost how to describe it? It's an oral an oral medication, so you put it in their mouth and it dissolves and absorbs into the gums, which is supposed to work better. The problem is sometimes with people who have overdosed, a lot of times you can't get their mouth open very easily, or for fear of them biting down unconsciously on the fingers, or sometimes just too hard to get to them, to the mouth area, so that would be something to consider. Most of the time your paramedics will carry both forms of Narcan. I do know that if you go to any of the Richland or Ashland County health centers, there's actually a class you can take, and with that class they will actually provide Narcan for you. It's a class meant for people who have addicts in their families or friends, and they're worried about them overdosing. You can actually get Narcan by taking that class to have on hand in case you were to find that person in overdose state. Interesting fact, maybe something to keep in mind. Okay. Our next group of drugs are called the stimulants. Now, of course, this is a wide range of drugs and substances. Okay, by definition, stimulants are used, and when they're used, they increase feelings of like well-being and energy and alertness, and oftentimes will suppress appetite. However, depending on which stimulant it is, it can be followed by bouts of depression. So it's kind of like you get that like high where you're full of energy and feeling great, and then would kind of sink down into a depressive state. These tend to be highly addictive. Okay, they have various medical treatments or medical reasons, or they also have some abuse reasons behind them too. So some medical things, so they are used to treat narcolepsy. So if someone has narcolepsy, which is where they have the uncontrollable urge and ability to fall asleep, which is particularly dangerous if that person is like operating heavy machinery or driving. They are used as that person would actually take some stimulants like daily to help treat that narcolepsy. Also, people who have attention deficit disorder or ADD will often be prescribed the drug Ritalin to help them focus. So a lot of times, and like I see this with some students too, a lot of times when there is a student, or even just a person, doesn't even have to be a student, who is having trouble focusing, kind of bouncing off the walls, easily distracted, and I mean really easily distracted. Oftentimes, if they drink coffee, now most people would be like, oh, coffee, that would make them even more distracted and more hyper and everything else like that, but oftentimes coffee gives them that feeling of almost calmness. Now, it doesn't technically calm them down, even though they might say it's calming them down. It technically is making them focus more, because coffee is a stimulant. Okay, caffeine is a stimulant, which is what you have in coffee, actually. And so when people who have ADD take something that has either caffeine or take their Ritalin, it doesn't suppress the nervous system to make them calm. It makes them able to focus in on things which allow them to give off the perception of being more calm. So caffeine, as I already mentioned, is part of the stimulant family, and maybe you're like me and slightly addicted to coffee and caffeine. You might notice that without your caffeine of the day, that you tend to get a little bit of like some withdrawal symptoms, maybe a headache, sluggish feeling, crabby. Those are mine at least. So technically, yes, caffeine is a drug. It is a stimulant, but the caffeine that you get in coffee or your pop is pretty low on the addiction scale. So even if you do get a little bit of an addiction going, you're not going to die from it. I have seen videos, however, and read some cases on where people have been so addicted to caffeine that they need a crazy amount of caffeine to survive the day, and it started messing with some heart issues that they've had too. Okay, and they were usually drinking like the energy drinks, and not just drinking like one of them, but drinking like 6 or 7 of them in 2 hours. So if you have a caffeine addiction, it's okay, me too. Nicotine, which we find in like your cigarettes typically, chewing tobacco, things like that. Now, those are all under stimulants. There are other stimulants too, which are more on the streets. So sometimes they're called uppers or speed. And what we see, especially with the street drugs, is once that stimulant wears off, severe depression usually sets in. And that's where the kind of addiction part of it takes off. So they take the stimulant, they feel great, everything's fine, and then they crash. Okay, and they get super depressed. And then there's that urge for them to get more of that stimulant. Sometimes they call it like the speed binge, because that urge, they want to keep feeling good. Okay, but to do that, they have to continue taking the drug. Okay, which is how a lot of the drugs work, at least mentally. The next kind of drug that we're talking about, which is a pretty big one when we're talking about crime and forensics, is methamphetamine, or sometimes you just call it meth. And so methamphetamine produces effects similar to crack cocaine, but does last longer. So crack cocaine also under a stimulant umbrella. We'll get into that next slide. But methamphetamine is often used instead of crack cocaine nowadays because of the longer lasting effects. And what we see is once these effects wear off, because the effects can last more than even 12 to 24 hours, once those effects wear off, there is still that crash that you experience with most drugs. And what we see is people who are highly addicted to meth oftentimes can even sleep for several days in a row after they come off one of their binges. Those who use it a lot, so chronic users, can exhibit violent and destructive behavior, and it's usually linked to some type of acute psychosis. So it's not like these people are just sitting down in a couch, sitting on a couch and just sitting there or watching TV while they're on meth. Oftentimes people who are on methamphetamines will go out and destroy something, will vandalize something. There have been cases where they hurt other people because they feel like they're going to get hurt from those people, even though it's their psychosis that's actually causing them to have those thoughts. Okay, so it's almost like that psychosis that they experience is almost what something like a paranoid schizophrenic would experience. Now, methamphetamine is what they define as like particularly unique and a dangerous drug. And one of the reasons why is that meth can be made fairly easily compared to the other drugs that you find on the streets. Meth is fairly easy to use and easy to make because a lot of the ingredients used to make meth are found in stores. No, I'm not going to tell you what ingredients are used to make meth. Feel like that would be bad, right? So not only is it easy to make, it's easy to get your hands on what is needed to make meth. The problem is with meth and cooking meth is the quality of it will obviously differ from one producer to another. And so we see that similar to how heroin has different levels of purity as does meth, which can cause people to have some major issues. Gross pictures coming up. You're used to this by now, part with me. Okay. Methamphetamine, as you, I'm sure, have seen in some like social media or in news or whatever, methamphetamine is one of the drugs that has the most telling effects on someone's physical appearance. So a lot of times people's teeth will be a sure sign of drug abuse. So methamphetamine has really acidic properties. And actually because of the the lower levels of pH, making it super acidic, because of those low pH levels, it actually attacks tooth enamel. Okay, and once you lose your tooth enamel, your body doesn't regenerate any more tooth enamel. Okay, so that protective outer covering of your teeth, methamphetamines actually destroy that layer, which then lead to rotting teeth. It can also lead to dry mouth syndrome, bruxism, which is when people like grind their teeth, and then jaw clenching because of the enamel and because of the nerves associated with the teeth. It can lead into those too. I've read a lot of case studies, both last year and going into this year too. Methamphetamine mouth. Teeth things are one of the things that bother me. I don't like feet, toenails, and yucky teeth. Alright, so, the one thing I was reading though was talking about the connections between vaping and teeth loss and meth and teeth loss. And so what they are finding is that the same additives and sugar compounds that a lot of the vaping juices have in them are causing the same wear and tear on the enamel of the teeth as what you would see with methamphetamines, leading to like the loss of someone's teeth, rotten teeth, and other dental diseases as well, even as early as in their 20s. So there's a lot of connections that can be made from one drug family to another. You've probably seen some of these too. So I talked about how that meth shows like the physical is one of the more physical characteristics, like affects your physicality more than almost any other drug. So these are mugshots of people that have the dates on them. These are people who have abused heroin, cocaine, alcohol, and meth, and a combination of those four.